We are very privileged to have this world-renowned specialist in regenerative medicine here at Pitt for these lectures, and I'm honored to introduce Dr. James Wang. So Dr. Wang received his bachelor and master degree in solid mechanics and experimental biomechanics from Tongji University in China, and he received his PhD in bioengineering from the University of Cincinnati. And he has completed postdoctoral research fellowship in the Texas University Health Science Center, Johns Hopkins Medical School, and Washington University. Currently, he's a professor in orthopedic surgery, bioengineering, biomechanical engineering and materials science, and physical medicine and rehabilitation. He's also the director of the mechanobiology lab in the Department of Orthopedic Surgery. So his primary research interest is in understanding the cellular and molecular mechanics of tendinopathy and the role of tendon ligament stem cells and tendon ligament mechanobiology. So his research is funded by NIH and a lot of other funding sources. He has more than 100 peer-reviewed published articles. So it's really an honor to have you here. And his lecture will be in tendon stem cells, aging, and exercise. Thank you for accepting the invitation.
Okay, thank you very much, Sarah, for the very nice introduction. And it's kind of really excited to come to in front of the students. Now, I came here in 1998, so has been 18, 19 years already. I taught a couple of years cell mechanobiology for first couple of years in bioengineering, but since then we professors too busy with writing grants, directing lab activities, so I haven't taught anything. So today I'm kind of privileged to see all the students sitting there, all talented students sitting there, okay? So now I'm going to talk about our research on the tendon, particularly stem cell mechanobiology, okay? Now, my name again is James Wang, and we also have a mechanobiology laboratory from the Department of Orthopedic Surgery, University of Pittsburgh School of Medicine. So now, for this group, I think that you can appreciate this kind of fact that tendinopathy or tendon injury, in general speaking, are very common problem in the sports medicine settings. Okay. Now, humans contains many tendons. Actually, you have a shoulder, have a rotator cuff, your elbow, and your wrist joint here, and the knee joint here, and ankle. All these joints connect with tendons in addition to the muscle, okay? Now, when you are very good talented sports kind of athletes, if you're good at tennis, a swimmer, you tend to have what we call tennis elbow, okay? That's actually a tendinopathy problem. If you're very good of a swimmer, okay? I think it's Philip, right? He's so good, okay? You got a rotator cuff. If you keep doing that, you got to look at the cuff tears, okay? And, NBA player, you have lots of problems. You have knee joint, you have a patellar tendinopathy. You also have Achilles tendon problem here, shoulder problem here, maybe also your elbow problems here, okay? Now, these days, we professor keep writing grants, Phoebe sitting there, she's smiling. So we spend lots of time. You get overused problem with the flex tendon here, or some here, lots of tendon here, okay? So again, it's a very prevalent problem here. Now, you may ask, what is a tendinopathy here? Now, basically, tendinopathy is what we call tendon inflammation and tendon degeneration. Now, in early stage, okay, when you have a tendon problem, you will experience the pain and the swelling, okay, and also sore in the injury site. Now, at the late stage, your tendon become degenerated. Okay, they have if you do the biopsy, you have called lipid tissue or fatty tissues inside the tendon, and also have a cartilage-like tissue we call macule, and last one called calcified tissue, basically kind of a bony tissue. Okay, now all these three types of tissues should not exist in tendon, in normal tendon. Okay, so that's what we call pathological condition of a tendon once you develop called tendinopathy. So now, of course, for a professor, we all research. If you want to do some research, you have to claim that's the bigger problem. Okay, when you submit the NIH grants to NIH, so that's the statement we used actually Tendon injury, very common problem, and it costs $1 billion. And to large extent, I know you someday, in maybe 2 years, you go on, find a job, and maybe find UPMC, you probably deal with lots of tendon problem from all the patients, okay? I work with Dr. Onishi, who is a PR physician, PMR physician, and Dr. Hogan, who is also a pediatric surgeon specializing ankle, okay? You got an Achilles tendon problem. You got a shoulder problem, okay? So I'm sure you would kind of face the challenge how to deal with the tendon problem here. Now, how do we study this tendon problem here? Now, in general, maybe 20 years ago, people think, oh, okay, while you have a problem, tendon problem, tendon is a load-bearing structure. So you have a mechanical loads placed on tendon. Now you have some cells. So the cells respond to mechanical loading, and they changes, okay, in response to the loading. This change can be what we call physiological, which you consider normal, but also can be called pathological changes. Now, during last 10 or 15 years, people that kind of have a new view because they do not think it's a regular cell. There's a specialized cell called stem cell, actually respond to the mechanical loading, which actually leads to the tissue pathological or physiological changes. In this case, is the tendons. Okay. Now, the question here, you may ask, what are the stem cells? Now, we may heard of different kinds of cells, okay? Different kinds of stem cells. Now, we have also talked about, let's say, embryo stem cell, all the other stem cell, okay? But here, we probably focus on adult stem cell, ASC. You may ask, what's ASC? Well, in our body, we are a live person, individual. There are many cells in your tissue. In tendon, they all have a stem cell. In liver, in lung, or organs, you have a stem cell. These cells keep you alive, keep me alive. Now, why is they are necessary? Because they continue to renew themselves and differentiate when needed. Okay. Now, what is the function of this ASC cell? Well, basically two functions here. One is to maintain homeostasis, and second is to repair the tissues. Okay, once injured. Now, in the case tendon, once tendon is injured, okay, these stem cells are responsible to repair, okay, or try to repair it, okay. So now let's look at the tendon structure. Well, if we do a longitudinal section here, the tendon, okay, like the patellar tendon or Achilles tendon, I'll show you in a minute. You can see this kind of structure here. This is pinkish, called extracellular matrix. Basically, it's made of collagen. Okay, tendon is made of 95% of collagen and some small protein glycans. This line-like cell, this kind of structure here, called tendon cell. Okay, now before 2007, everyone, including the textbook, think tendon only contains one type of cell called tenocyte. By 2007, Dr. P at the NIH first reported that human tendons and mouse tendons also contain second type of cell called tendon stem cell. Okay, so now everyone considers that's the truth. Tendon contains two types of cell, tenocytes and a tendon stem cell. Now, second thing I want you to remember is the tendon. We're talking about this Achilles tendon, patellar tendon. They are subject to mechanical loading. In the patellar tendon and Achilles tendon, they call subject to uniaxial loading. In other words, it is subject to one direction, there's a stretch, okay, like this. So now, the first thing I want to share with you, the findings we made on the tendon stem cell. So now, we focus on two types of tendons. As I mentioned, you have a patellar tendon, which is located in your knee joint here. And the second one called Achilles tendon, which is located near the ankle. Okay. And these two tendons are kind of subject to large mechanical loading when you're walking, when you're running, when you're jumping. Okay. So they are load-bearing structure. They're designed in such a way. Okay. Now, in order to do the study, tendon research, you need some model, animal model. So in the sports medicine, I'm a faculty also pediatric surgery. So we Well, sports medicine, you need to do research. So we use the large animal, the little large animal like rabbits. So we're using the rabbits as experimental model to do the tendon mechanobiology research, tendinopathy, and also in orthopedic surgery. I'm sure you heard called ACL reconstruction, anterior cruciate ligament reconstruction, and also last one, tendon biomechanics study. Now, in our research, we focus on tendon stem cell. So we basically isolate tendon stem cell from the patella tendon and Achilles tendon and grow them in a culture. Now you can see all these in the we call flask, okay, T25 flask. You can see many colonies here. These are we call tendon stem cell colonies here. And here for Achilles tendon, you can see same thing. However, you can appreciate that there are much more patella tendon stem cell colony than Achilles tendon stem cell colony. Okay, now that's a fact. Patella tendon contains more stem cell and they grow fast than Achilles tendon. Okay, so that's maybe explain why once Achilles tendon injury is very difficult to regenerate, but the patella tendon is better. Okay. So now you may ask, what do they look like? Well, in vivo it's very hard to see how the tendon stem cell look like, but in vitro, in culture, we can see look like for tendon stem cell, they look like a cobblestone. Okay, they have very large nuclei in the middle of the cells, but for the tendinocytes, they are highly elongated. Okay, in terms of their shape. Now, these phenotype we call phenotypes is called fibroblast phenotype. Okay, so tenocytes basically we also call it kind of like tendon fibroblasts. So now we want to see are there any difference between the tenocytes and the tendon stem cell in terms of growth rate? So here we have a patella tendon stem cell. We also have a patella tenocytes, Achilles tendon stem cell, and Achilles tenocytes. And we use population doubling time, called PDT, basically to measure how much time it takes for the cell population to double the cells. Okay, for the patella tendon stem cell in culture, it takes about 40 hours to double its population. But for patella tendon, you need 80 hours. Achilles tendon need about 90 hours, and the Achilles tenocytes even more. You're talking about more than 140 hours. So you can appreciate that patella tendon stem cell or Achilles tendon stem cell grow faster than the tenocytes, and the patella tendon stem cell grow faster than patella tenocytes. Okay, that's almost always true. Stem cell grow fast. Okay, than the we call differentiated cell like tenocytes. So now, in order for the cell to be qualified as a stem cell, they must express specific markers. Okay, so in this case, we look at several markers here. That's for patella tendon stem cell. That's called Achilles tendon stem cell and the tenocytes. Now, one marker we look into is called October 4. Okay, now these are pinkish located in cell nuclei. That's called October 4. It's transcription factor. Okay, and the second one called SSEA4. That's all green. Okay, located on the cell surface. Okay, and the last one called nuclear stemming NS. They're also located in the cell nuclei here. All these pink dots. Now, as you can see here, for all patella tendon stem cell and Achilles tendon stem cell, they all express these three markers. But for tenocytes, they do not. Okay, they nothing. For immunohistochemistry, no signal. Okay, positive signal. So now, stem cell. If you say, hey, the cell stem cell, they must be able to differentiate to become different type of cell. So in the culture, in the in vitro conditions, we can induce these cells to become, we call lipid tissue here. Okay, this is for patella tendon stem cell. This is for Achilles tendon stem cell. They form the lipids, basically fatty tissue here. They also can become cartilage-like tissue. You can see all this staining, basically all the protein glycan accumulation on the cell surface. Now, interestingly, in the dish, petri dish or small dish, you can make the cartilage-like tissue out of tendon stem cell. The cells start with monolayer like this. After 21 days, they become a small tissue like this. It's kind of like a cartilage. Okay, in your, let's say, in knee joint, you have cartilage like this. Of course, these cells also can become called bone cell. In here, you have lots of what called calcium accumulation on the cell surface. So now, that's in vitro, everything's good and well. But what happened to in vivo? So we inject these called tendon stem cell into animals. Okay, we use noodle rats injected in beneath the skin. Okay, so these cells actually can form we call tendon-like tissue structure here. Now we use immunohistochemistry to detect the type of tissue. These called collagen type 1, which is specifically expressed by the tendons here. So that's the tendon-like tissue. They also form the cartilage tissue. These are protein glycan accumulation like here. And lastly, they can form bone-like tissue here. Okay, that's a structure, typically like a bone cancellous bone structure here. So now, the summary, the information I just try to convey is, in tendon, in addition to tenocytes, tendons contain stem cell called tendon stem or progenitor cell. Tendon stem cell form the colony in culture, express stem cell markers, and possess marked differentiation potential. So now, everything good. We identify stem cell. We know two population of stem cell and tenocytes in tendon. What happens to them when you become aged? We all age. Now, that's a picture I downloaded from the Google. That's typical. When you have a baby, very young, and a toddler, and a young adult, and then become adults, and then middle-aged man, and then you get old. I'm probably around here. Okay, I don't know where. I probably around here. Okay, starting age. Okay, so now that's the physical appearance. Okay, it's so cute when you're a baby. Okay, and toddler, it's kind of also so active. And when you're getting old, your physical appearance has changed. Your physical strength, we're talking about physical therapy, physical strength also downgrade. Okay? Now what happened to the cells? We use, of course, the animal models here. We use aging mice. In this case, we only use kind of 3-month-old mice and also 9-month mice. You can see from the 3-month mice, we can isolate these tendon stem cells. They look very shiny, look beautiful, okay, in culture. But when we get the stem cell from 9-month-old mice, you get a very large looking the cells, okay. You have some cells very big, and these cells tend to elongate. It's not like a cobblestone tendon stem cell anymore, okay. And we look at the stem cell marker expression here. For 2.5 months old mice, you can see almost 100% these cells expressing called October 4. As I mentioned to you, it's a marker of a stem cell. And also, this almost 100% expressing the SSEA1 for 2.5 months old mice. But when you become 9 months old, okay, you only have a few cells expressing October 4, almost none expressing SSEA1. In other words, the quality of a tendon stem cell in aging mice, okay, also deteriorate. Okay, not many left. Okay. Now we do some quantification. Again, we use called PDT, population doubling time here. For 2.5 months mice and 5 months mice and 9 months old mice, you can see the cell growth rate also decreased with age. For 2.5 mice, it only takes about, let's say, 18 hours to double its population. But for 5 months, you need more than 30 hours. 9 months, you need 60 hours. So everything getting slowed down also. So it's not just quality. Your growth potential also decrease. So that's also the take-home message here for this aging effect on the tendon stem cell. First, we call the proliferative potential of tendon stem cell decrease. Okay, so these cells tend to grow very slow. Okay, Second, the quality of a tendon stem cell also deteriorate with age. Okay. Now, these two factors, quality and quantity, okay, affects your body. Okay. In our case, affects your tendon, the quality of a tendon. Okay. When you're getting old, your tendon quality is bad because of what? The tendon stem cell deteriorate. So the tendon tended to be fragile and easily to be injured. Okay. So now, okay, so A, you're getting old, the tendon is not so good as when you're young. Is there any way we can kind of improve it? Okay. Of course, if you're asking some pharmaceutical research, they will say we are inventing, we are trying to develop some drug. Okay. And you take it, you become young. Okay. Well, I hope so, but unfortunately, people spend $1 billion. Okay, so far there's no such magic drugs you can do that. Okay, and of course, if you find one thing is good. Okay, so metformin, diabetes drug, they can prolong life. Unfortunately, you have so many side effects. Okay, your life quality is very bad. Even you prolong your life, let's say a couple of years or 5 years. Okay, but your life is very miserable when you're taking this kind of drug. Well, exercise probably is a solution. Okay, good solution. I'll tell you why. Well, if you want to study the effects of exercise on tendons, on aging the tendons, you have two ways you can do that. First, we can do the in vitro. So basically, isolate the stem cell from the aging the mice or rats or rabbits. Then we put this on this machine here. This machine we call stretch machine, okay, or we call cell exercise system. It's a little bit of fancy word, okay? You're putting there this cell, tendon stem cell, and then you have what we call kind of camshaft system, okay? You keep stretching them, just like you're walking around or jumping around. Your cell being stretched.
Is it
okay?
cyclical?
It's a cyclical stretch. Yes, it's a cyclical. Okay. So now we make sure actually these cells sitting on this area, their stress environment is kind of uniform. Okay. It does not change with different location on this part. Okay. And so then that's kind of mimic your in vivo conditions. Then we see what happened to these cells. So that's the experiment condition we use. We stretch the cell, we call 4%, 8%, okay, at 0.5 hertz every 2 seconds, and you have one cycle, okay, and stretch 2 hours a day for 3 days, okay. That's the kind of stretching condition we apply to the cells, and then after that we look at the cell response, okay, by we call quantitative PCR and immunohistochemistry. Okay, see what happened to this cell. So here are the results. Well, for the cell sitting on the kind of we call silicone substrate without a stretch, these cells did express we call nuclear stemming in all these pink dots. Okay, all these dots. But after 4% stretch, relative small stretch on these cells, you have seen more cell and seems the signal more bright. Okay, all these expressing this, the marker of a stem cell. But at 8% stretch, you seem to reduce a little bit the nuclear stemming expression out of the cell being stretched. So we do some quantification and see that's a control, which means no stretch. The cell just sitting in the silicone dish. Okay, and we have about maybe 65% on average of the cells expressing this stem cell marker called nuclear stemming or NS. But after 4% stretch, okay, they have about 90% of the cell expressing this stem cell marker. But on the contrary, at 8% stretch, you have a few cells actually compared to even control. Okay, so from this data, what we see here, appropriate or moderate stretch or exercise are good to the cells, aging stem cell, but overstretch are bad. Okay. okay, in terms of reduce the expression of a tendon stem cell marker. Now, we look at other markers here, or two. Now one marker called NANOG, which is also stem cell marker. Another thing is called collagen 1, which is the tendon, main components, okay, collagen 1, and tenomargin, which is a marker of a tendon, okay, or tendon cell, tenocytes. You can see here for control, that's the baseline. 4% stretch, we consider the small stretch. You have highly expressed NANOG and collagen 1 and tenomargin, okay. But 8%, you only actually does not actually elevate so much as 4%. Okay. So in other words, 4% elevate stem cell marker expression and the tenocytes marker expression, collagen 1 and tenomargin. But 8% is not as effective as 4%. Now what happened to the other markers we call non-tenocytes marker? Now this is a little bit LPL, basically is a fatty tissue marker. SOX9 is a cartilage marker. In other words, when the cell express this marker, they start to differentiate into the cartilage cell. They produce cartilage, okay. And 1X2, which is a marker of a bone cell. So you look at it here, control baseline, 4%, very little change of this non-tenocytes marker, which is good. In tendons, you don't want this fatty tissue, you don't want a cartilage tissue, you don't want a bony tissue exist in tendons. But 8%, you see, all three markers are elevated. Okay, so in other words, overstretch or maybe it's over-exercise are bad. Okay, now we have more data actually showing that. Okay, appropriate exercise is beneficial. Over-exercise actually is detrimental. So now, everything we do actually is in vitro. Okay, we call cell exercise. Well, you can argue, say, well, it's not a human being, okay? It's not a physiological, okay? You isocell, there's no tendon tissue surrounding the cells, okay? So in this case, we say, okay, let's do the in vivo study. So we use the mice, okay? So we put the mice on the treadmill. So some of you must do the treadmill. I do sometimes, okay? Run, right? Treadmill run, right? Keep it fit, right? That's how they put the mice to running, okay? So now, in this case, in this study, we basically use 18 aging mice, 9 months old. Now, people will argue, say, well, why not use older mice, 20 months old? Well, when you become 20 months old, maybe around more than 70 years old, human being, okay, human, they're not very good to run. So not very good at running anymore, okay? So we kind of have to compromise, 9 months old. And then we call moderate treadmill running, basically run called 13 minutes per minute, 50 minutes a day, not too long, okay? I'll run probably 45 minutes or 1 hour or something, okay? 5 days a week, yes, 5 days a week, and 3 weeks, just run, okay? And of course, like us, we take Saturdays and Sunday off, okay? For students, probably different story, I know. Then we isolate the tendon stem cell from the mouse, the patella tendon, and see what happened to these cells. Now here are the results. For the cage control, which means they're just running around the cage, okay? You do the sectioning, you actually see lots of fatty tissue inside the tendon here, which means what? Tendon become already degenerated. Okay, the fatty tissue should not exist in normal tendon. Now after treadmill running, you only see a few small portion of fatty tissue here. In other words, after 3 weeks of treadmill running, just 15 minutes a day, the fatty tissue is gone. Most of the fatty tissue are gone. Okay, but we only look at 3 weeks running. Okay, you can see that. And then we do some quantification here. Treadmill running, only very few, actually, small amount of fatty tissue in the tendon. For cage control, you have a high amount of fatty tissue there. Okay. And then we look at the stem cell marker expression. Okay. In the cage control, you see only a few cells express the nuclear stemming, which is a marker of a tendon stem cell. But after treadmill running, the same mice actually you can express lots of nuclear stemming here, all this red signal here. Okay, in other words, after treadmill running, you have a more stem cell, okay, in the tendon. Okay. So now we do some quantification, and so the kg control. You have a few nuclear stemming expressing cells here, but after treadmill running, you basically increased these nuclear stemming cells here, inside the tendon. Now, you may wonder, say, okay, inside the tendon, can we isolate them and see if they are different? Actually, we did that. We isolated from the mice in kg control. We also isolate the tendon stem cell from the treadmill running, after treadmill running. And you can see, for kg control group, you will see very loud cell. Now, I'm not going to too deep on the topic. These cells, we consider them called senescent cell. Senescent cell basically means the cell sitting around doing nothing good, but do everything bad. Okay, we call senescent cell. Okay, and after treadmill running, you can see all these cells. Last we call cobblestone. Remember, these are very good tendon stem cell. Of course, you can see still some pancake-like cell, which is also we call senescent cell. In other words, treadmill running is very good, or moderate exercise good, and can improve the stem cell quality, okay, in the tendons. So we do the semi-quantification. You can see for moderate treadmill running, you increase what we call cobblestone cell, basically the stem cell. And for control, you only have a kg control cell, mice. You don't have many, okay, good quality stem cell here. And we also look at the cell number. Actually, after treadmill running, now we didn't do anything, just isolate them from the treadmill running group and from kg control group. And you can see that naturally become what? After treadmill running, they grow faster, okay, compared to the control, kg control group. Okay. So the message here, I'm sure you want to hear that since you are specialized in physical therapy. Called moderate exercise in vitro, in vivo, increase number of tendon stem cells and enhance their quality. Okay, that's the first message. Second one, moderate exercise help reduce fatty tissue formation in aging tendons, likely through blocking differentiation of tendon stem cell into adipocytes, basically called fatty tissue cell. So in this case, if you want to treat the patients, older patients, if they can do a little bit of exercise, their tendon quality can be improved. Okay, improved by exercise. That's what we call stem cell based mechanism. Okay, for the improvements. Okay. So next one, last topic, I want to share with you some of our findings about the effects of exercise on tendon wound healing in aging rats. Okay. Now, in this study, we used the 24 aging rats. Now, we did actually use the 20 months old, a little bit old, I think much older than the 9 months old mice. Okay. And these rats actually subject to what we call moderate treadmill running. Again, this moderate treadmill running is defined as 30 meters per minute, 50 minutes a day, 5 days a week for 3 weeks. And then after treadmill running, we make wounds on the patella tendon of these rats. And then we get a small piece of tissue. We grow this tissue here in the culture. Okay. And then after that, rats have a tendon wounds. We let them run on treadmill, or let them kind of continue put in a cage. So that the tendon wounds heal over the time. We actually look at 2 time points here, 4 and 8 weeks post injury. Okay. So here, what do we see here? For the young rats, you can see typical, we call the feature of the tendons. They looks very shiny, glistening actually. Okay, very shiny here. Okay. But for older mice or rats here, 20 months older rat, you can see all these the color is very different, yellowish. Okay, and then you also see lots of kind of vessel across in the we call palatine on the tendon surface here. You can see all these things. Now after the moderated treadmill running, you can see the color change. Okay, it's almost close to close to normal, but not normal yet. Phoebe, you have a question? Yeah.
How did you injure the tendon?
What's that?
How did you injure the tendon?
Oh, we actually cut a window here in the middle of a patella tendon. Yeah. So that's we after treadmill running, you can grossly inspection shows that the tendon seems improved. Okay. Then of course we look at the cells. For 20 months old rats, you can see these cell morphology. They are kind of more ellipse, kind of like a round shape, more round shape. Okay, like this here. But after treadmill running, they become more elongated. Now these are typical actually the tendon cell in normal tendon cell. When you're young, we do the section, you use tendon cell look like this. When you're old, you get a tendon cell look like this. It's more like a degenerative phenotype of these cells here. Now, then of course we say we made a window defects. For cage control, 4 weeks, you can still see kind of the injured side here. It's about from here to here, okay, and here for cage control. But after the moderate treadmill running, you can very small wounds, okay, compared to the cage control here. In other words, after treadmill running, moderate treadmill running, the wound healed faster compared to cage control without treadmill running. Now that's also true actually we did a histology, and then you look at that cage control. If we do the section here, in the wound area, you still have a called empty space here, okay, and not healed. But for moderate treadmill running group, you only have see few areas is still empty, okay, at 4 weeks. Most areas are healed, okay, compared to cage control here. And here look at 8 weeks, you still can see kind of the wound area here for cage control group, but for a moderate treadmill running group, you see almost a complete heal, very little here. And look at here, the area. You see for cage control group, you still have empty area. So it's a healing is still kind of going on, it's not finished yet. Okay. But for moderate treadmill group, the window defects or injury site is completely healed. Okay, all the tissues filled in this defects. Okay. Now, so other things so we look at it, we call senescence cell, because the cell senescence is very important. You know, once the tissue injured, the cell have to come to the injured site, so start proliferating, they start producing the matrix, like intending the collagen. Okay, so filling these wounds. But once the job is done, these cells have to undergo we call apoptosis. Basically, they have to die. Okay, they leave the healed area. But in this case here, for aging the rats, for cage control, you see 4 weeks, you still have seen many large empty space. And you also see this blue staining, we call beta-gal staining, which is a marker of a senescent cell. They see lots of cells actually, okay, senescent. But for MTR group, moderate treadmill running, you only see few. And the area, the wound areas, again, is kind of to a large extent are healed. And then look at the cage control at 8 weeks, you still can see large number of senescent cells, but for MTR group, you only see a few areas which expressed the beta-gal. Okay, so the totally they are in total different healing stage when you compare the cage control group versus the moderate treadmill running group. So now what happens if the cell, looking at cell, we isolate the cell from cage control group, and isolate from cell from moderate treadmill running group. So now here is we use this equal number of tissue, same weight, and put in the flask. And you can see immediately, you can appreciate that in moderate treadmill running group, you have more stem cell colonies, all these dots, compared to cage control. right? Simply because exercise, we call moderate exercise. Then we look at the colony size. For kg control, the colony doesn't look very good. Okay, the cell shape is not very cobblestone, but for the MTR group, you have a see kind of very nice colony, and the shape is more like a cobblestone. Okay, which I already told you, they are actually the real tendon stem cell. So now we do them again quantification in terms of the stem cell growth rate. We use a population doubling time, and you see after moderate treadmill running, these cells actually again grew much faster compared to kg control here. And look at the stem cell marker expression here. We use the October 4, NANOG, and the nuclear stemming as a marker, stem cell marker here. You can see for kg control, only few cells express these three markers. But for moderate treadmill running group, you can see most of the cells actually express all these three stem cell markers, October 4, NANOG, and the nuclear stemming here. And I'll do some quantification, and you can see actually October 4 and the NANOG and the kg control group is red, moderate treadmill running group is green. You can see both stem cell markers, okay, are increased in these cells, okay, in these cells from the moderate treadmill running group compared to kg control. Now for nuclear stemming, there's not much difference, statistically speaking, not much difference here. And because we know nuclear stemming is kind of, we call a marker of a progenitor cell, tendon progenitor cell, not a stem cell per se, okay. Okay, then we also look at the collagen and the tendon markers here. Collagen 1 and collagen 3 and tenomargin 3 are markers for tendons, okay. And we can see after moderate treadmill running, the gene expression of these three markers is much higher in the moderate treadmill running group compared to kg control. In other words, moderate exercise promotes tendon formation, okay, in these cells, okay, or inside the tendons. And so that's the message I want to share with you here. So moderate treadmill running accelerates the wound healing in aging tendons, as evidenced by quicker wound closure compared to the kg control. And the second message is such accelerated wound healing in injured tendon likely results from increased proliferation of tendon stem cell, and they are enhanced stemness due to moderate treadmill running. So what is overall take-home message? If you forget everything what I just said, that's the take-home message, okay? You may be used someday in your clinical practice, maybe in 2 years, 3 years, okay? First thing, tendons contain stem cell, which may play an important role in the maintenance or repair of tendons, okay? So may patient ask you, say, hey, so doctor, what happened to my tendons? Well, you say, something wrong with your tendon stem cell, okay? So we need to do something to your tendon stem cell. Now, aging, when you get old, aging leads to deterioration of tendon stem cell with both the quality and the quantity. Okay, in other words, aging leads to decrease the number of stem cell and also decrease the quality of a stem cell, okay, in your tendons. Now, third one, which is good news, you want to improve your tendon conditions, you can perform moderate treadmill exercise. Okay, so after this research we did a couple of years ago, so I bought a treadmill last year, so I started running every day, 45 minutes to 1 hour, okay, not too much. So I try to improve my tendon. So far my tendon has no problem. Yeah. So again, it's a very good opportunity to talk to you about our research. Of course, many people work in the lab, and especially Dr. John actually is instrumental in collecting or performing this study I just presented to you. And of course, when we do research, we all need the funding, to make it possible. So, energy funding from NAMS and also support from the Department of Orthopedic Surgery. So thank you very much. I'm ready to take your question. Okay, thank you.